Well, did you know that cataracts are the leading cause of blindness in people over 40 years old? Does that shock you? Well, if you've been told you have cataracts and you're not really sure where to go or what to do, we have some tips and advice for you that really may help you out. Dr. Paul Petelin, he's an ophthalmologist with Nationwide Vision and is here to put you at ease and give you some insight. Ha! That's a joke, Dr. Petelin.
Very good.
You know, and a lot of people don't realize that going to Nationwide, it's so much more than just getting a pair of glasses or a pair of contacts.
Right. Nationwide's largely been in retail, glasses and contacts, as you mentioned, but for over a decade now, they've been doing a lot of surgical eye care, medical eye care. You had Dr. Myers on, I think, a few weeks ago talking about the importance of diabetic screenings and so forth. Same holds true for surgical problems, with the most common one by far being cataracts, as you mentioned.
And what are cataracts exactly?
You know, cataracts are really just an aging change that everybody's eye goes through. It's a change in the lens of the eye, a cloudiness that occurs in the lens of the eye, and the average age that it really starts to become a problem for patients is typically in their mid to late 60s, early 70s, and sometimes it can be very subtle, and patients aren't always aware that that's really why they're not satisfied with how they're seeing.
What are some of the symptoms that we should be looking out for? Because it can happen much younger too.
Yeah, great question.
You know, at least 40.
Yeah, great question. Sometimes patients can get them at a younger age for a variety of medical reasons, but typically patients will feel like they have glare at nighttime, difficulty driving under poor contrast conditions and so forth. And oftentimes it's just a general feeling that they're just not seeing things that they think they should see, the small ticker on the TV, being able to track a golf ball as it leaves the club face into
the important things in life.
The really important things in life. So,
is it preventable?
Not really. I mean, the ARED study showed that diet and some of the things, ultraviolet exposure maybe contributes, but in some respects it's kind of one of these things that we're just all destined to get at some point in time as we get older.
So really the point is, you know, you can head to Nationwide, have an eye exam. If you're determined that you have cataracts, the good news is there's so many advancements in the treatments for cataract surgery. Tell us about that.
Yes, that's probably the most exciting thing about surgery, is that this cataract surgery for many years has been a wonderful surgery. It's very efficient. Patients do great. It's a very patient-friendly procedure. But in the last 10 years especially, the technologies that we have that we can use at the time of surgery, they can really fix just about anything that might be wrong with someone's eyes. So it's really become a wonderful stepping stone for patients to not only get better clarity because their cataract is taken care of, but also really kick their glasses to the curb, you know, and that's made it more satisfying than it's ever been.
And the procedures, the advancements in that type of technology requires less downtime. Are you being put to sleep at all?
No. These are really wonderfully simple outpatient procedures. Patients are not put to sleep. I mean, from start to finish, the procedure takes sometimes less than 10 minutes.
No way.
Yep.
And both eyes?
Yeah.
Sometimes...
No. In the United States, we still do one eye at a time.
Oh, okay.
And we usually separate the two by a couple weeks if it looks like the patient requires surgery in both eyes. But we even can put the medicines in the eye now at the time of surgery, so the hassle and inconvenience of drops and the expense of drops is essentially eliminated. So it's gotten to a point where it's hard to imagine it really getting much better than what it is.
That's encouraging.
Yes.
I mean, certainly if you determine that you have cataracts, it's important that you get them taken care of, isn't it?
Yeah, I mean, it's never an emergency.
Okay.
But it's important for people to realize that can frequently be a reason that they're not as happy with how they're seeing as they would like to, and it can be a gradual change, and it's good to get checked when you're in that age group especially.
Yes, and it all starts with that all-important eye exam. And if you're concerned, you wonder about your eyes, you wonder, you know, maybe if you do have cataracts, you need to get your eyes checked. Nationwide Vision, here's that number to call. They have multiple locations across the valley. 1-800-EYE-CARE, or you can learn more at nationwidevision.com.